Hello and welcome to the AWARENS Self-Directed Learning. This module is on Code White Awareness. This is a general introduction to Code White Awareness. We will be covering the following topics: de-escalation tips, what is Code White, the purpose of Code White, guiding principles for Code White, the roles and the responsibilities of all the parties involved, the Code White situation, other things to consider during Code White, debriefing, as well as general staff education and training in regards to Code White. Before we begin to review what Code White is, the roles and responsibilities, and what to do in a Code White situation, we want to review 10 de-escalation techniques that we always hope that these techniques can be used successfully so that the situation does not result in a Code White having to be initiated. The first de-escalation tip is to be empathetic and non-judgmental. When someone says or does something that you perceive as weird or irrational, try not to judge or discount their feelings, whether or not you think the feelings are justified. They're real to the other person, so pay attention to them. Keep in mind that whenever a person is going through, it may be the most important thing in their life at that moment. The second tip is to respect personal space. It is always important when someone is escalating in their behavior that you remain a safe distance. 3 feet is a guide that can be used, but always remember that there are going to be situations when it is best that you leave altogether. Allowing personal space tends to decrease a person's anxiety and can help prevent them from acting out further. If prior or when there's not an escalated situation and you're entering someone's personal space to provide care, explain your actions so that the person feels less confused and frightened when possible. The next tip is using non-threatening, non-verbal communication. The more a person loses control, the less that they hear the words, and the more they react to your nonverbal communication. So be mindful of your gestures, your facial expressions, movements, and your tone of voice. Tip 4 is to avoid overreacting. Remain calm, rational, and professional. While you can't control the person's behavior, how you respond to their behavior will have a direct effect on whether the situation escalates or diffuses. Positive thoughts like telling yourself, "I can handle this and I know what to do," will help you maintain your own rationality and calm the person down. De-escalation tip number 5 is to focus on feelings. Facts are important, but how a person feels is at the heart of the matter. Yet some people have trouble identifying how they feel about what is happening to them. Watch and listen carefully to the person's real message. Try saying something like, "That must be scary." Positive words like this will let the person know that you understand what's happening and you may be able to get a positive response. Tip number 6, ignore challenging questions. Answering challenging questions often result in a power struggle. When a person challenges your authority, redirect their attention to the issue at hand. Ignore the challenge, but not the person, bringing their focus back to how you can work together to resolve the problem. The next tip is around setting limits. If a person's behavior is belligerent, defensive, and disruptive, give them clear, simple, and enforceable limits. Offer concise and respectful choices and consequences. A person who's upset may not be able to focus on anything you say. Be clear, speak simply, and offer the positive choice first. Tip number 8 is choose wisely what you assist upon. It is important to be thoughtful in deciding which rules are negligible and which are not. For example, if a person does not want to shower in the morning, can you allow them to choose the time of day that feels best for them? If you offer a person options and flexibility, you may be able to avoid unnecessary escalation. Tip number 9. Allow silence for reflection. We've all experienced awkward silence. While it may seem counterintuitive to let moments of silence occur, sometimes it is the best choice. It can give a person a chance to reflect on what's happening and how he or she needs to proceed. And finally, tip number 10, allow time for decisions. When a person is upset, they may not be able to think clearly. Give them a moment to think through what you have said. A person's stress rises when they feel they are stressed. Allow time being calm. It is our hope that these tips are a reminder of other education and training that you have probably had on de-escalation. If we keep these 10 tips in mind, hopefully they will work and we do not need to initiate a code white. What is code white? Code white refers to a trained team response to a threat that is a behavioral emergency involving a client, a resident, a person supported, or family member, or outside intruder. A code white indicates the level of intensity has increased and there is imminent risk of harm to self or others. In the event that a code white is initiated at the facility, all staff will follow the specific training procedures. Your organization will have a specific procedure and additional training will be needed for code white team members. This is intended to be a general awareness session. The purpose of code white is to gain control of an escalating situation or a perceived or known threat in which a resident, visitor, family member, or unknown person's behavior are beyond the staff's ability to control. The purpose of code white is to provide the aggressive person with the best and safest care until the person regains control of their behavior. It is also to prevent injury to the aggressive persons and others present, as well as to prevent property damage. Remember, the goal of the situation is to gain control safely. That is what's most important. We are now going to review some guiding principles for code white. These are just some of the guiding principles that are the best practices in the industry. There may be additional principles that may be included with your organization's guiding principles. Code white team physical intervention is used as a last resort to safely control a physically acting out person until the person regains control of their behavior. A verbally aggressive person is managed through verbal diffusing techniques. The person involved is always treated with the utmost respect and professionalism. Safety priority always occurs in the following order at all times: self and other staff, then others, visitors and family members, and then the environment. Does not intervene in any situation that may pose a risk beyond their resources. Untrained individuals are not to participate directly as a code white team member, but may function in a supportive role when asked to do so. What your role may be if you are not trained as a code white team member will be further discussed by your organization in their procedure. Code White team members must receive initial training and regular refresher training. Debriefing is to be conducted by the Code White team leader immediately following any Code White team response. Documentation is a very important part of the Code White protocol. We will now review the roles and responsibilities of the senior leadership team, the Code White team, managers and supervisors, staff, and the JOSH committee. The senior leadership team needs to support and promote commitment to the Workplace Violence Prevention Program, which is the overarching program where your Code White procedures will live. Provide resources for the Workplace Violence Prevention Program, including but not limited to the Code White team response and to the training and orientation of all staff. The senior leadership team needs to assign specific leadership responsibilities for the development, implementation, and review of the Workplace Violence Prevention Program, including the Code White team response. Ensuring appropriate policies and procedures are established to eliminate or minimize aggressive behaviors. The Code White team members. They need to assure that when a Code White is called, that the team and the Code White leader follow the policies and procedures to ensure the health and safety of both the staff and the residents. Ensure the implementation, monitoring, and evaluation of the Code White program, policies, and procedures. Ensure that risk assessments are completed to identify real and potential hazards contributing to aggressive behaviors against staff and residents. Understanding the level of risk is essential to successfully gaining control in a Code White situation. When we look at the roles and the responsibilities of the managers, supervisors, and team leads, actively promoting the use of de-escalation techniques and support staff during and after a Code White is called. You need to ensure that effective support, reporting, follow-up, and monitoring procedures are in place to address incidents of aggressive behavior as a standard of practice. Ensure all aggressive incidents are investigated and corrective actions identified and taken to prevent reoccurrence. Roles and responsibilities for staff. Staff need to actively participate in workplace violent risk assessment processes by providing input and feedback. Learn and use techniques to avoid aggressive situations or potential aggressive acts, including their roles and responsibilities in a Code White situation. Knowing when to redirect or to walk away is very important. Apply policies and procedures related to workplace aggressions. Report and document all incidents of aggression. We sometimes normalize some of these aggressive behaviors, so it's very important that we report them at all times. The Joint Occupational Health and Safety Committee, JOSH, has a very important role in monitoring the Workplace Violence Prevention Program by reviewing statistical information such as risk assessment results, training records, incident reports, and investigation reports, reviewing incidents of violence and debriefing documents, and making recommendation for preventive strategies where necessary. When appropriate and necessary, participating in investigation of incidents involving violence in the workplace. Now that we have reviewed everyone's roles and responsibilities, we will now review what happens when a call is initiated. Staff involved in a situation or the first staff member who comes upon a scene identifies that a situation exists where that requires immediate assistance. If there is a weapon involved and if there is immediate risk of significant harm, you need to call 911. They will ask you several questions such as your location and details on the situation. Once that has been done, you then proceed to your code white procedure. When a weapon is not involved in a situation, then you go directly to the starting of initiating a call in code white. So if you are directly involved in the situation or the first person that comes along to the scene, you need to know how to initiate a code white. Now I'm going to use the example for Grandview Manor. In their procedure, for example, it says to use the desk phone, go to the desk phone, use the page button, or from their portable phones to press star 62 and press the green button. So you will have to find out for your organization exactly what the mechanism is to have that page or to make the call for code white. Once you have that mechanism and you understand that, you need to announce code white 3 times. There may be times when you're not able to access a phone, then you need to call out for help and identify that it is a code white by, again, repeating code white 3 times. There may be other panic buttons or alarms throughout the facility that you need to be aware of and understand how they were used and how they are to be used in a code white situation. You also need to know how you will initiate a code white in other common areas like dining rooms, sitting rooms, solariums, front entry, garden areas. So your procedure should explain how that is to happen. So make sure that you know the area that you're working in, how you would initiate a code white. Most oftentimes this is done through a phone paging system. Staff that are working in the area or the unit where a code white has been initiated. If you have a code white in your unit or work area, all staff on the unit are to respond as long as they can safely leave the task that they are performing or you are performing. Wait for any further direction or assistance from the code white team leader. During a code white, there are many things we have to consider. Most importantly, to protect your personal safety and others, to stay a safe distance away from an agitated individual. Position yourself so there is an escape route always available. If possible, remove any objects that could be used as an instrument of harm and follow the procedures outlined for requesting assistance that will be outlined in your specific organization's procedure. We also need to consider directing other staff as necessary to reduce the stimulation in the area, like removing all residents, visitors from the area, reducing the noise level by turning off radios, TVs, and vacuum cleaners and other activities. You may also want to have available the residents' records or chart available if possible. Provide information to the code white team leader about the situation and any actions that have already taken place. And in the event that a resident is a place of seclusion, ensure the room is ready to receive an individual. We will now move in to debriefing. This is after the code white situation has come to a safe resolution. However, even though the code white has come to a safe resolution, whether it's an actual incident or a drill, it is important and also part of the regulations that we have a debriefing. Debriefing is important for many reasons. To look at and develop the team's ongoing skills, so what went well and what didn't go so well. After a code white, there may be a need to refine policies and procedures related to the prevention and management of code white situations. The other area that's very important when it comes to debriefing is for the mental health of all the persons who were involved in participating in the Code White situation, starting from the person who comes along to the scene, is involved in the scene, and is involved in taking care of the situation. So what does this mean? At the conclusion of a Code White incident, the Code White team leader will ensure that all responding team members that participated in a Code White debriefing session, as well as any staff that were involved in the initiation of the Code White call, will be involved in the debriefing. The Code White team leader or designate or the lead of a debriefing will lead the debriefing session to discuss the effectiveness of the response, recognize the things that went well, and identify opportunities for improvement. Ideally, the debriefing will take place immediately after the conclusion of the Code White incident or as soon as possible afterwards. The debriefing that we have just discussed is many times a group debriefing after a Code White incident, and it does help and define those areas that we discussed. It often, though, doesn't give an opportunity to make recommendations. What we just discussed is debriefing, and that debriefing is usually done in a group setting, and it is very helpful for the group to participate in that and really cover what went well and what didn't go well. However, a group debriefing cannot address the individual needs for support after a crisis event. Following up is a requirement of all persons involved in the Code White situation. The Code White team leader will check in with each individual involved. They will inform the individual of support available to them in the organization, and if necessary, refer them and the individuals to the employee and family assistance programs or whatever programs you may have in your organization. The last topic that we will be discussing is general staff training and education. In addition to core education and training on prevention and management of aggressive behaviors, general staff training includes reading policies and procedures regarding workplace violence prevention and Code White, taking possibly the self-directed module on Code White awareness, and other practical drills and exercises like tabletop scenarios that may be done quarterly, for example, in your respective units. As we wrap up the Code White awareness, this was to give a general overview of what Code White is, what you need to do when you come across a Code White situation, as well as the roles and responsibilities of all the members involved. It is really important that you understand the specific procedures and your policies and guiding principles in your organization. Now that you have completed the self-directed training module, you can click on the link below the video where it says Post-Assessment Questionnaire. You will fill out your name, your organization, and you will answer the questions. If you get the questions correct and get 100%, a certificate will come up that you can print off or save. If you get a question wrong, it will ask you to try again. You can try as many times as you need to till you get 100%, and then you will get your certificate. Thank you.